Hello, my name's Abby. I'm going to be your nurse today. I'm going to do a quick HEENT exam on you. How are you doing today?
Good, how about you?
Good. So I'm just going to start with a few questions. Have you had any, I see you're wearing glasses.
Mm-hmm.
How long have you had glasses for?
Since about the 4th grade.
4th grade? Have you ever worn contacts?
No.
Okay. Do you get regular yearly eye exams?
Yes.
Okay, good. Have you ever had any eye surgeries?
No.
Okay, any family history of like any eye cancer, throat cancer, anything like that?
Not that I know of.
Okay. Are you having any pain at the moment in your head, neck, ears, throat, anything like that? Anything?
No.
Okay. And I'm just gonna get into the assessment area, okay?
Okay.
If you have any questions throughout it, just stop me, okay?
Mm-hmm.
So I'm gonna start with your head, and I'm just gonna look at your head. I'm looking at your face, looking that it's symmetrical, and I'm just gonna feel your scalp, making sure there's no bumps, like that. Now I'm gonna feel your sinuses. No pain, right?
No.
Okay. Perfect. Okay, now I'm gonna get into the eye exam. Okay, so for this I'm gonna have you do a few tests, okay? So first, to test your visual acuity, I'm going to have you look at this Snellen chart. So can you read the bottom line for me?
WFNA.
Okay, great. And can you cover your left eye? Now take off your glasses. That was with your glasses. And now cover your left eye. And now can you read that line again?
No.
No, you can't read it. Let's go up one.
No.
No, okay, now let's go up another one.
JLVW.
Perfect. Okay, now switch to the next eye. All right, can you read that first line down at the bottom?
No.
No, okay, can you go up one?
No.
And to the other top one?
JLNVW.
Great, okay. So that was testing your visual acuity, and now I'm going to test your visual fields just by, tell me when you can see my fingers, okay?
Mm-hmm. Now.
Okay, great. Now I'm going to do the convergence test. Just going to come in with my finger. Perfect. And now I'm going to do the cover-uncover test. When I remove this paper, you shouldn't have any lateral movement in the eye that I'm taking the cover off of. Perfect. Now I'm going to do another test. Look at my finger. And this is testing your ocular muscles. And right back into the middle. Perfect. And now I'm going to get my pen light and I'm going to look at your pupils. Okay, so I'm just going to quickly look at them, making sure they're dilating to my light, looking like they're round, equal, and reactive. They're dilating to my light, of course. And now I'm going to see if they're directing consensual, meaning when I shine this light into your left eye, your pupil dilates on your right eye. And I'm doing it again on this eye. Perfect. And we'll do it again on the left, just to check. And again on the right. Great. Now I'm going to get into the fundoscopic exam and get my ophthalmoscope and look at and make sure I see the red reflex. So now I'm just going to look into your eye. And great, I see the red reflex. And I see it again. Now that concludes my eye exam. So now I'm going to get into looking at your ears. So are you having any pain in your ears right now?
No.
No? Okay, great. I'm just gonna do a quick test that we should do before we assess your ears, just to make sure you're not having any inner ear pain. It's called the pull test, so I just pull back on your pinna right there. Are you having any pain when I pull back?
No.
No? Okay. Do you have any history of ear infections?
No.
No? Okay, great. So now I'm just gonna inspect his ears. Can you look at me? Straight on? Great. Looking that his ears are nice and symmetrical. I'm looking at all of the ear. I'm looking, making sure there's no inflammation, lesions, sores, nothing like that. And now I'm gonna look inside your inner ear. Oh, and before I do, actually, I'm gonna do the whisper test. So can you plug your right ear for me? And I'm just gonna whisper a word into your ear, and can you tell me what I say?
Car.
Great. And same with this one.
Did you say ball?
Yes, I said ball. Correct. Now I'm going to do the, I'm going to look inside your ear with my otoscope. So I pull back on your ear, up and back, and I'm just gonna visualize, making sure it's there's no it's nice and pink, and there's no excessive drainage or anything like that. Yours are looking great. Same on this side. Everything's looking great. So that concludes my ear exam. Now I'm gonna get into your nose exam. I'm gonna keep my otoscope because I'm going to use that to look inside your nose. I'm just going to set it down right here because first I'm going to just look at your nose, look at the outside. It looks nice and symmetrical to your face. I don't see any lesions or anything like that. Do you have you had any, do you have any history of any problems with your nose?
No.
No? Okay, great. Are you having any pain in your nose right now?
No.
No? Okay. Now I'm just going to, first I'm going to test if he has his sense of smell. Can you close your eyes for me? And can you tell me what this is?
Garlic.
Great. So that can show me that he has his correct sense of smell. Now I'm going to look inside your nose. So just tip your head back for me. Just like that. Great. Thank you. And now I'm just going to look inside. But being careful because the mucosa is very sensitive. So I'm looking inside, I'm looking at the turbinates, making sure it's nice and pink inside. There's, again, no excessive drainage, and it looks great in there. No bumps, nothing like that. Looks great. Okay, now I'm gonna get into the throat exam. So I'm gonna get my pen light again because I need to look inside your throat. So, do you have any issues, pain in your mouth right now?
No.
Any sores or anything like that?
No.
Do you get regular dental checkups?
Yes.
Great. Have you had your wisdom teeth removed?
Only my top ones.
Only your top ones? Okay. Can you look at me? Open up your mouth. Okay. And I'm just gonna look inside, looking at your mucosa and your hard palate and your soft palate. Stick your tongue out for me, and I'm gonna visualize the uvula. Lift your tongue up, look underneath the tongue, look at all his teeth. Perfect. Looking at the gums. Everything is nice and pink. And say ah.
Ah.
Great. Nothing looks infected or anything in there. Okay, now I'm just gonna feel your lymph nodes and look at the rest of your neck and just visualize your neck. So look at me again. Alright, so just by looking at you, again, your neck I don't see any lesions, no bumps, anything like that. The bumps I'm looking for would be swollen lymph nodes or a goiter from your thyroid gland, which I would visually be able to see very well. So now I'm going to feel your lymph nodes. then behind the ear, right here in the back of the neck. So I don't feel anything swollen, I don't feel any abnormal bumps or anything like that, so that looks great. And now I'm just gonna finish by feeling your thyroid again, feeling for any goiters or abnormal bumps or anything like that, okay? Tip your head back, and I'm feeling it right down in here. Swallow nice for me, great. And again, I don't feel any bumps or anything like that, so that looks great. So that concludes my HEENT exam. Do you have any questions for me?
No.
Great, okay, thank you.
You're welcome.